Hey, 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 welcome to Your Personal Health with Dr. Burris, Dr. Kim. Hey, guys, welcome. Happy holidays.
Yes, to you too.
Can you feel it? It's in the air. It's that magical time, even though the rest of the world is still dealing with things. We're talking about the holidays. So you guys look good.
Well, my kids were disappointed I didn't do no shave November, so they're asking me to do don't shave December. So that's
I,
why I haven't shaved. It's not like I look like this all the time, but I
I
told them
thought
I would try it, but it's hard. It feels weird.
I thought maybe you were delivering babies all night. I didn't know for sure. Well, welcome. Hey, before we get into it, there's we had gone a long, long time and always reported every week on this whole COVID pandemic, and then it looked like things were kind of calming down a little bit. And you said we'd only come back if there were some updates. And I know this is it Omicron or Omicron? My wife insists
Um,
it's Omicron. So
yeah, I think that's probably the best pronunciation I've heard. I don't speak Greek, so I'm not 100% sure, but I think several pronunciations are acceptable, and
I thought
I'm gonna do Omicron from now.
I like that. Well, I thought, hey, if you don't mind, I would love for you to give us a variant update since it's one of those things. It is being taken seriously. Not that it was ever not being taken seriously, but I've seen now my favorite sports teams are not able to field a complete roster, and they're canceling games, and things are being canceled again. So, do you have just a few minutes and just give us an update on where we are with this?
Sure. The United States is seeing entry of the Omicron variant into the United States now. Our first cases were found back in 2 weeks ago, and it's pretty exponentially growing. So, what that means is our cases are doubling now every 2 to 3 days of the Omicron variant versus Delta, which was about every 5 to 6 days. So, it's more transmissible, meaning that it um, is more easily passed, and it looks like it makes you sick relatively quickly. Um, the second sort of unfortunate thing about this virus is that 2 shots of a vaccine are not sufficient. Um, it looks like it's escaping vaccine coverage, and 2 shots of a vaccine only give you about a 30% chance of not catching it. So if you get your booster, your chance of not catching it goes way up to about 70%. So that's still not perfect, but it's much better than 30%. And so that's why you're seeing sort of this encouragement to go get a booster shot. Um, it looks like natural immunity, that's for people who've had COVID previously, is also less protective than vaccination. So if you've had COVID previously, you can't actually rely on it to protect you the second time around. Last time we talked about it, we didn't know yet whether it was going to be less severe, more severe. There were some initial data coming out that was maybe hopeful that might be less severe, but further data, again, it's still early data, but further data is not holding to that less severe pattern. The Europe is about a week or two ahead of us, with about 3 weeks actually, with the Omicron variant. So they're seeing the impact of their hospitalizations now from the variant over the last week or so, and it does look like it's following very similar patterns to Delta. So, because it's so contagious and vaccines are less protective against catching it, that means that it's going to hit areas very hard and fast. So that means our case rates are going to skyrocket over the next month. And people who do not have previous vaccination are going to have a higher risk of severe disease, as well as people who are vaccinated but have underlying medical conditions or are immunocompromised or are elderly. So we still have this concern for our vulnerable population. The good news, if there is any, is that we do have a lot of people vaccinated, and so we're hoping that if we can vaccinate enough people this week to mitigate that surge a bit, we might not crush the hospital system. However, one of the major fears about this is that because the vaccination is not as good at protecting people from catching it, that our healthcare workforce is more likely to catch it, either out in the community or in their own home, if someone else brings it home, or at work. And therefore, they are also more likely to be absent from work during this surge. So that means our healthcare system is going to be overwhelmed at a time when their already depleted staffing is getting sick. So as a doctor looking forward, I'm saying, gosh, if there's anything you can do to avoid catching this for the next month, you should try because that's really the period of time where we as healthcare people are going to be the most needed, as well as if you do go to seek healthcare, you're going into a system that is under maximum stress. So again, it might not be the best time to schedule an elective surgery. If it can wait, wait. If you can't wait, don't wait. Please go get the care you need. But this is sort of where we are. So we're going into the holidays. A lot of people gathering who are fully vaccinated, who feel pretty bulletproof right now. It's a good time to make sure you've got your booster. And then remember that you don't have 100% protection from this variant. You still need to wear your mask indoors, and you still need to really consider small symptoms as potential COVID and don't go to an event. So if you've got a runny nose and sniffles and a sore throat, but you don't feel all that sick, don't go. Just try really hard not to spread anything right now. It would be really helpful. So that's the update.
I think what she said in terms of not just the doctors. I mean, everyone who has a workforce is going to be impacted, because if people start, even if they're not sick, if they test positive, they're going to be home for 10 days. And certain businesses, one employee being home for 10 days is going to crush them. And so that's the ripple effect of this whole thing. And then ambulance drivers, police workforce, firefighter. I mean, there's a lot of things that we infrastructure wise rely upon. If we start knocking those down, it's going to be harder. And the other thing I want to remind people, the tests that we have aren't bulletproof either. Even the PCRs will miss something that's an obvious COVID case. So don't just rely on your home test to say, oh, well, I have all the symptoms and it's negative, I can go. Just be very careful.
Yeah, it feels like we're moving into that. I hate to be I'm not a doomsdayer, but that perfect storm. We're just a few days away from literally millions of people traveling for the holidays, getting on planes and trains and buses and moving around the country. And the fact that even if you've had the booster, by the way, I had the booster shot last Monday after the show. And, for the next probably 3 days, I did not feel normal. I wasn't, only the next day did I not do much, but it took 2 or 3 days to get through that, even though it was only half the dose. It was interesting. We'll talk about that later if we do, but it feels like my wife and I, we were teeter-tottering back. Should we get it? Should we not get it? And the only thing that drove us to really get that, or I should say the tipping point, was the fact that we're traveling to Arizona to see her family. We said, you know what, let's make sure that we're squared away. And then we saw the numbers, as you said, 30% without and 70% with. I'll take the 70% with. So it, like I said, it feels like we're in a perfect storm. Boy, every place you go here in the desert, I'm sure around the country, is just jamming. We had friends that went to LA over the weekend, and they just said it was just bumper to bumper, like pre-pandemic. And I just hope we haven't totally let our guards down. What do you think?
I think, thinking back into what we know about this virus, so there's individual risk and there's societal burden, I would say. So if you look at your individual risk and you say, hey, I've been boosted, I'm going to do this traveling, likely if you get sick, you're going to have a very mild case. Your individual risk for this virus at this point is very low. And this is a totally different situation than we were going into that first winter. So that first winter, we had no therapeutics, we had no vaccine, we had no idea how the virus was going to behave, and it was very scary. We're in a totally different situation now. Yeah, it's a new variant, but it still is behaving like COVID, and we know what to expect. We know who's the highest risk. We know how to protect ourselves. And so even though it may seem like, hey, we're back at square one, we're not really. But it is, discouraging. Without the Omicron variant, I think this would have felt a lot more normal this year for the holidays. I think people would have felt a lot more comfortable going to large events indoors without, even masks. I mean, that's sort of, in my mind, the gold standard of normal, when people can go to, say, a concert or a large service and not think about it. We're not there yet. I still think that with, in California, we have an indoor mask mandate. Most places do not. But I think that is maybe our best bet to cap our peak a bit lower, because this thing is so contagious. It's as contagious as measles. That means we're playing a different game now. If somebody walks through the room 5 minutes before you and had a 30-second conversation, and then you walk through there 5 minutes later and have another conversation, you could catch it. And this is a totally different situation than standing around and talking to someone 2 feet apart for 15 minutes being your risk.
Wow.
So this is just so much more contagious.
And most people are going to just hear about people that, were asymptomatic or got a little sick. We're the ones that are more likely to see the ones that had a worse outcome, not just death, but, in the hospital and out of the hospital. And so, those are the things we're trying to prevent, because those individuals shouldn't have to, at this point in the game, go there, because there's a lot of things we know about, but from various choices from lots of different things and factors, they end up there. And that's what makes us kind of discouraged that, here we are, 2 years later, we know what's up, we know how to help these types of vulnerable people, yet they still are ending up in the hospital. And so, that's really, I guess, from a healthcare perspective, why we're asking people to mask up again indoors and be a little careful now, because it will spread through the community, and I'm thinking, okay, if I come up with someone without, most likely I'll get it because it's so contagious. But like you, we're trying to put all those layers in, like that Swiss cheese model, so that it won't ding us so much, rather than a direct shot at our immune system. So,
yeah.
One of the things that, and then we'll move on, but one of the things that really got my attention and my ears perked up was when you said, the speed at which it is growing, and the fact that even if they've had the 2 shots or even the Johnson single shot, which I guess is not doing as well either, that it's going to impact our frontline workers like yourselves and other people that we rely on, we just take for granted. And how important is it to get that message out to those people and like, hey, we really need to get that booster shot right away? Because I know that was, again, it was a 50-50 kind of thing for so many that I've spoken to, like, I don't know, do I really need it? Yeah, you do need it. So how important is that to get that message out?
I think, especially for a vulnerable population, that's probably the most important message, because right now only 50% of our people over 65 have had the booster. So that's sort
What
of
was that? I'm sorry, what was that percentage again?
50.
50. Okay. Thank you.
So, that's tens of millions of people who are kind of a little less protected than we would like. And, I'm boosting my teenage kid, which I'm trying to keep that kid from getting sick and missing like a couple weeks of sports and possibly having a bad outcome from the COVID, but that's less likely. But I worry more and made 100% sure grandma got that shot a long time ago,
Yeah.
So because of the rate at which this is increasing, people have very little time. And if you don't have your booster yet, don't wait for a better day when it's more convenient. Just go today. Just find one and go get one, because your time is kind of already out. And the earlier you get it, the more protection you'll have in a week or 2 weeks. So before Omicron, I was like, yeah, make sure you get it on a Friday. So if you have symptoms, it's a problem. Now I'm just like, yeah, please, now. In fact, skip lunch, go get it. Like it's kind of that urgent.
You said something. I want to just make sure this point is very clear for those people catching it live or seeing it recorded a little later. Do we have any data on the severity? Are we seeing a lot of people go in the hospital, or is it just an uncomfortable situation for them? What do we know about that?
So what we know is that it's looking like it's behaving very similar to Delta, which means that primarily the people who are in the hospital with Omicron are unvaccinated people, or people in those high-risk categories who have heart disease, diabetes, obesity, also lung disease, immunocompromised conditions. So it's primarily the same people who are at risk in previous rounds that are showing up with Omicron. So from that perspective, it looks like in the early data from the Europe that's how it's behaving, and it's not significantly different. People who've had 2 shots are more likely to catch this than with Delta, but they're not really more likely to end up in the hospital. So the original vaccine still gives you pretty good protection against severe disease, which is great. But it's not going to do much for slowing down that community transmission, which is sort of a secondary goal of vaccination.
Yeah, it's like the Delta was on bicycles, and now Omicron has a motorcycle.
It's an electric bike.
It's a motorcycle.
Yeah.
And so it's going to reach populations quicker, faster. So the spike, instead of being kind of a slow, it's going to be bunched together because it's just a quick mover. So that, that's probably why we'll see a little bit of a bump than we probably would have in the winter, only because of the swiftness of this virus.
So this whole thing about wear our mask. We're in this period here in California for the next 30 days. What is it? The 15th to the 15th of mask mandate. We really kind of got ahead of it, if you will. And if you're traveling, making sure you're having that booster, even if you're not traveling, having that booster, and really limit these larger gatherings. Is that a fair kind of guide?
Yeah, I would say think carefully. Maybe choose one or two to go to rather than cramming in one every day.
Mm,
Especially if you're low risk. If you're high risk, you might avoid all of them. But it also has to do with your risk tolerance and how important that event is for you. Um, but also consider, maybe not staying around to chat with people for a half an hour. Maybe you just attend the event and kind of, go outside to the parking lot and talk to a couple people, but don't like crowd around inside.
yeah.
And I view it also like, there are some cities that they're whether they do anything or not, it's alright. Like New York, it's too late. I mean, they are such an international city that Omicron was there, probably 2, 3, 4 weeks ago. We're not so much. So, we're a little bit ahead of the game in that sense. So it really depends on, are you going into even more of a rural community? Not that you don't have to wear the masks, but they're probably going to be a couple of weeks behind us. And so if they get behind, in front of that, then they have a better chance of dodging it all. But it really depends on the amount of people you are, how international you are. And LA, is in trouble. But, how many people come in and out from LA? I mean, that makes our valley a little bit more vulnerable too.
Also, if you live in a rural community, it's easy to feel like you're sort of, secure and away from the big cities. So you're not going to like have the big spikes. The problem is when somebody gets into trouble in a small community, in a small hospital, they usually transfer those patients to the large cities, to the big hospitals. And so with these peaks, what's been happening in a lot of our states where they've had these peaks is that the cities are full. The hospitals cannot accept transfers. And so very ill patients are staying in small community hospitals that don't have the resources to care for them. And because of that, they have higher death rates. So that is one of the things that affect people, even if you feel like you're not in the middle of the storm. That storm is going to throw out some waves that have further effects.
Wow. Well, first of all, thank you for the update. I know we went a little longer. We kind of ate right into the show. I apologize, but I thought it was very important to kind of update everybody with what was going on, especially since we are moving into a heavy travel time and family time with the holidays. So, if you're out there watching this and you're watching it in replay, take note, do as Dr. Burris recommend, and just be safe out there. Use that mask. Oh, speaking of that, how often should we? Because now we've had this little bit of a break. How often should we be replacing our mask?
Well, this is a surgical mask. It is rated for 15 minutes of use.
Oh, whoops.
So even in like the first day of the pandemic, we went well over what these suckers were rated for. um,
Mm.
you're supposed to change them every time you interact with a different patient. Again, that is no longer happening. It hasn't been for years. So the answer to that is, if your mask gets wet, definitely replace it, especially if it's a disposable mask. It's no longer functioning well as a filter at all. Just toss it. You might as well just tie gauze around your face at that point. So if you are using a reusable cloth mask, then again, I recommend after a couple hours of use, you probably wash it. And if you're using this one, I try to replace them after a couple hours of use if I have a supply. Mostly because at that point, if you've been breathing through it, it gets kind of yucky. Also, a lot of people just use a mask that's sitting around in their car and they just throw it on to run into a store and then put it back in there, and it may have been weeks. If you think about, it's sort of like, would you use a napkin that you'd been constantly reusing and putting back in your car. If you wouldn't use the napkin, it's probably time to replace the mask.
Okay, I certainly get the picture, and I'll get rid of those masks in my in my glove box right away. I am
Everybody does it.
I'm guilty. I'm totally guilty of that. Just okay. Do I have one in the car that I can run in and whatever? Okay, so there are some that I don't need to throw away. I probably need to burn them
Yeah.
and restock. So
Well,
thank you for that.
and it's not just the COVID risk. I mean, these things will gather strep and staph on them too, and give you a skin infection or mask knee or so.
Jeez.
Yeah,
Okay.
it's just in general hygiene.
Well, happy holidays, everybody, and get rid of that mask. Give somebody you love a new set of masks, those 50-pack. You can probably pick them up at your local pharmacy, and that would be a great gift to give somebody. And so, change often, and don't put them in the glove box or in your console that you're using over and over for several, I don't know, months. Just get rid of those. So thank you very much. We've really kind of eaten into the entire show, but I think this is real important. One quick thing I want you to kind of give us an overall. We've been talking a lot about the parents of newborns and at 0 to 6 months, because that is that real. Let's face it, it's a period of time where you have a newborn baby outside the womb now, and they're trying to function. What are some of the things? Just give us 3 or 4 tips of good health for the parent, and 3 or 4 tips of good health for the baby through this holiday season, and then we'll let you go.
So since we've been talking about Omicron, I think maybe it's good to talk about it for parents of newborns this holiday. This is a really tricky subject to negotiate anyways, of trying to keep your baby healthy when they are at their most vulnerable, which is those first few months of life. Also, because if your baby gets a fever at less than 3 months old, that's an automatic admission to the hospital, or it should be, because that's a sepsis workup, and there are a lot of things that can affect the baby. So keeping your baby from catching a cold during those first 3 months is actually important to keep them out of the hospital. So with Omicron out there, honestly, if it were me, I would probably keep my baby at home the whole time. I probably wouldn't go out, and I would probably minimize me going out. And if you have the ability to sort of keep the mom and baby, or the dad and the baby, whoever's going to be the primary caregiver, as separate during this next month or two, that would be really good for their physical health. For their mental health, that's really difficult. It's really hard to be isolated, and especially during the holidays. So that person might want to pick up an N95 mask and wear that every time they go out of the house, and keep the baby at home. This is not a popular advice, but it is my best advice given the certain circumstances of this holiday season, and also the fact that this looks like it's going to move through really quickly. So if you could do that for, like, say, 6 weeks, you really lessen the chance of bringing Omicron to the baby and having to deal with that, because that is not fun. Infants are higher risk for hospitalization and severe disease from COVID. So they are a high risk group, and we do want to protect them.
I would say the caveat is, if you could, walk around your block, if you live in New York City, that's going to be hard. But if you live in a normal, neighborhood, you can go outside, take your baby for a walk. The cold air itself won't get your baby sick. It's the interaction with other people that transfers the viruses.
I'm sorry if I implied that. I meant taking the baby into a situation where there's a lot of people around them, like the grocery store or a family party, something like that. So yeah, go outside, get some sun, go for walks, go to the park, even, going to the park where there are other people around is fine, as long as they're not like up looking at your baby real close. So And do not put a mask on an infant.
Mm.
That's dangerous. Don't do that.
Don't put a mask on anyone that can't take their own mask off.
Right.
Great point. Well, guys, really, thank you so much. I appreciate this, and just the words of caution for everybody. Share this video with people that you know and love, and because sometimes it's almost like when we give the advice, meaning we're giving advice to our loved ones, we're the bad guys. Let Dr. Burris and Dr. Kim be the one delivering the news because they are the experts, and you're just sharing it because you love them and you're concerned about them. And as you see, they're smiling. They don't mind being the bad guys if it means your personal health is secure and safe, or at its very best, not compromised. So please take that into account. Dr. Burris, Dr. Kim, I just want to wish you both a great holiday. I know this week is going to get busy for everybody. Be safe out there, and thank you for all that you do. I know you said something that still I'm struggling with, because you said it's been 2 years since we started this process. That just blows my mind that's been going on. So, hey, we have this much invested. Let's not jump off the ship yet. Let's go ahead and get through this and knock this next variant on its keister. And let's start 2022 healthy, happy, and have a prosperous new year. So, guys, thank you so much. Be safe out there, and we'll see you next week on, or excuse me, are you guys, I was going to ask you about next week. I know it's kind of right in the middle. Do you want to wait and get together in 2022?
You'll have to ask the boss.
I don't see why not. It's not going to be 2022 next week, right?
No, it's
We're
going
just like
to be,
getting close.
yeah, it's a week from today, so it'd be the 27th.
27th. Yeah, I think we're good. I mean, honestly, as doctors, like, we just keep working. We don't really know what day.
All right, so then we'll see you next Monday on Your Personal Health. And in the meantime, be safe. If you celebrate Christmas, Merry Christmas to everyone, and be safe out there. Thank you so much, you guys. Be safe. Bye-bye.